Hello, this is a short educational video where I will be talking about cystic fibrosis. I'll be explaining the pathophysiology of cystic fibrosis, also known as CF, and I will discuss the common prescribed medication which is used for managing this condition. I will share how the disease affects the body and how different medications work to manage the symptoms and complications. Cystic fibrosis is a genetic disorder in which affects the respiratory and digestive systems, although it can also impact other organs. It is caused by a mutation of the CFTR gene. The gene is responsible as it produces a protein called cystic fibrosis, which is a transmembrane conductance regulator. This regulates the movement of salt and water in and out of the cells in various organs, which is usually in the lungs and pancreas. A person who has CF, the protein doesn't function properly due to the gene mutation. The result of this, the cells produce a thick, sticky mucus instead of the thin, watery mucus that our bodies need for it to function normally. The thick mucus blocks the airway in the lungs, trapping bacteria, making it hard for someone who has CF to breathe. I will now break down what happens in the body when someone with cystic fibrosis. The CFTR protein is found in various organs, however, the role of it is important in all the lungs, digestive system, and the sweat glands. In healthy individuals, the CFTR proteins help regulate the flow of sodium and chloride, which maintains a proper balance of both salt and water. However, the CF patients, the regulation fails because the CFTR protein is not present or dysfunctional. In the lungs, the malfunction causes the mucus, which becomes thick and sticky. This leads to clogged airways. The trapped mucus creates an ideal environment for bacteria to grow, which results in frequent lung infections, inflammation, and progressive lung damage. Over time, having repeated infection can cause scarring of the lung tissue, which is also known as fibrosis. This is where patients develop chronic disease respiratory issues, including shortness of breath, wheezing, and persistent cough. Beyond our lungs, CF affects other systems. For example, in the pancreas, the thick mucus blocks the release of any digestive enzymes, leading to malabsorption of nutrients, poor growth, and frequent bowel issues. However, CF patients also tend to have high salt levels in their sweat, which can lead to imbalances of body's electrolytes. As a multisystemic impacts CF, treatment focusing on managing the complications and maintaining the patient's quality of life. An important medication that is used to look after cystic fibrosis is Dornus alfa, also known as pulmazine. The class of drugs, mucolytic, is where Dornus alfa belongs to. The medications are designed specifically which break down the mucus, making it thinner and clears it from the lungs. The mechanism of the action breaks down the extracellular DNA as its major components of the thick mucus which is in CF patients. As the lung cells die due to infection and inflammation, DNA releases into mucus, which makes it thicker. Dornus alfa cuts DNA strands, which reduces viscosity of the mucus, meaning the patients can cough up and clear out the mucus from their lungs, thus leading to improved lung function and reduction in the consistency of lung infections. Dornus alfa is indicated specifically for those with cystic fibrosis as it manages the buildup of their thick mucus. It's prescribed to both children and adults with CF and is administered via the nebulizer once or twice a day. For nurses administering the Dornus alfa, there are two things to think about which is important. It's essential to ensure the patient understands how to use the nebulizer correctly as it will maximize the effectiveness of the medication. Using the inhaler with the correct technique is important as the medication will be able to reach the lower part of the lung where the mucus buildup is the most severe. Also, it's important to monitor the respiratory status for the patient both before and after the treatment, as you can assess improvements or adverse effects. The Dornus alfa is usually well tolerated. There may be some side effects for patients which are mild. They can include hoarseness, sore throat, or any change in their voice. It is important to educate the patient of the importance of consistency and having regular administration as it's key as it will prevent mucus buildup, therefore maintaining lung function. Finally, nurses need to monitor signs of any worsening respiratory function. As CF patients have frequent exacerbations, it is important to keep an eye on the symptoms, including increased cough, fever, difficulty in breathing, reporting Reporting these changes quickly to a healthcare provider so early intervention is ensured, which prevents further lung damage. Connecting back to the pathophysiology designed earlier, we remember that for CF, the primary function is the sticky mucus, which is in the lungs, to the dysfunctional CFTR protein. Dornase alpha will help to break down the DNA mucus, thus making it less thick and sticky. This will directly address the impaired mucus clearance in the system. As it thins, the mucus Dornase alpha will provide the patient's lung function, reducing infections, and helps the patient breathe easier, slowing down the progression of any lung damage. This is important for the patient's long-term management of their cystic fibrosis. This is especially towards respiratory failure, as it is one of the leading causes of morbidity and mortality in CF patients. As we summarize all of this, cystic fibrosis is a complex multi-system disease which is caused by different mutations in the CFTR gene, which leads to mucus buildup, especially in the lungs. The medication Dornase alpha will play a crucial role towards thinning the mucus, improving lung function. As we manage CF effectively, we will require combinations of medications, therapy, and careful monitoring, which will improve the patient's quality of life. Thank you very much for watching this, and I hope the information has helped you understand the pathophysiology of cystic fibrosis and how the pharmacological management helps this condition. And here are all the references that I used today. Thank you.